Okay, we're going to briefly go over some denture care and cleaning, as well as care and cleaning of the oral mucosa that bears the denture. So for a top denture, you're going to remove the denture, and when you remove it, you're going to rinse it underwater to remove any saliva and loose debris. And then you're going to lightly brush off the remaining adhesive from the denture. So on a top denture, that adhesive would be on the top where it sticks to the gums. So you're going to take a brush and you're just going to lightly brush that old adhesive off. You're then going to get your detergent or solvent ready. So I've included on the paperwork that I'll give you a couple brands of denture cleaner that are ADA approved and recommended by dentists. So you're going to obviously always follow the manufacturer's instructions. Most of the time it's a tablet that you will dissolve into a plastic container that has a tight fitting lid or cover. So you'll put the warm water in the cup, again based on the manufacturer's instructions on how much water. You'll always want to use warm water to encourage the removal of that debris and the antimicrobial aspects of it. However, you want to avoid hot or boiling water as it can morph and warp the denture. So again, warm water based on manufacturer's instructions. You're going to place that tablet in there, and once that's dissolved in the water, you're going to fully submerge the denture in that container and cover it. And then you're going to let that sit for usually 10 to 15 minutes, but again, it's really based on the manufacturer's instructions and recommendations. Once that's done soaking, you'll then remove the denture, rinse it underwater to remove anything that may have loosened up while in that solvent, as well as the chemicals, and then you're going to empty and clean that container that you submerged the denture in. And remember to always use fresh solvent every time you're cleaning these dentures. So at the end of this, you soak it, you remove the denture, you empty that container out, clean it, so that the next time you remember you need to use new solvent or solution. Once that denture is removed, you're going to brush the denture using a denture brush with water and a soap or a mild detergent. And again, just brushing off any debris that may be remaining with that soap and water, and then rinse it again. If you're not ready to put it back in the patient's mouth, anytime the denture is out of the mouth, you'll want to make sure it's placed in cool water or a cleaning solution. And again, remember, no hot or boiling water. To care for and clean the patient's mouth or the resident's mouth, every time that denture is removed, anytime the denture is removed, you want to be rinsing the mouth with warm, either fluorinated water, or if the resident's diet allows, a mild salt water. Obviously, if the resident is on a salt-restricted diet, salt water is not ideal, so that's when you could use that warm fluorinated water. When the denture is out, you'll want to look over the mouth and look for any change in tissue, like an ulcer or a sore. If there are any changes in the tissue, you'll want to note that and keep record of that so that we can let the dentist know. At least once a day, you should be using a soft bristled brush to lightly brush over the tissue where the denture sits. So in a top denture, it'd be those gums and that soft and hard palate. So you'll get that soft bristled brush, and you will use long, soft, straight strokes, and you'll start in the back of the mouth and move forward. Always start in the back, moving forward. And while you're in there, clean the tongue as well, either with the brush or with a tongue cleaner. It's also recommended that we massage the mucosa and the gums and the tissue, which can be done by placing your thumb and your index finger along the ridge and using a massaging press and release stroke. And for the soft palate and the hard palate, you can use the ball of your thumb to kind of massage that as well. If you have any questions, I've got this document typed up that you can keep handy with you, either in the resident's room or on you. It just kind of gives you a step-by-step instruction on what we should be doing with both the denture and the patient's mouth. It also gives you a couple examples of denture cleaning products that, like I said, are ADA approved and dentist recommended. It's also got a picture of a potential container that you could use, as well as a denture brush.